one argument in opposition to Senate Bill 440, which is a false claim of threat to patient safety. This is false claim because in numerous other states and for 30 years, doctors of optometry have been performing these procedures safely. This is a false claim because the opposition will say that we do not have the appropriate education and training. What they actually mean is that we do not have their education and training.
After getting my undergraduate degree at Cornell, thank you, I went to medical school for 4 years, which included not only basic science, but over 2 years of supervised clinical face-to-face training. But he said to have made the following statement: if you think it's expensive to have an expert do the job, wait until you hire an amateur. Please.
First, I want to make it clear that we are not amateurs, that the procedures that we're looking for here are things that are within our training and education and have been for decades. Lack of access to care is not just in the North Country, it is statewide. A survey of New Hampshire optometrists found that providers in all areas of the state struggle with between 2 to 6 month wait times for referrals, and many are impacted by the inability to refer to Dartmouth.
I recently saw a patient who was 104 years old whose vision was decreased to a haze that commonly develops behind the lens implant after cataract surgery. If I were still practicing in Colorado, I could have treated her that day within minutes. This patient had to return on a different day with her daughter, who needed to take more time out of work to see a different provider that she's not familiar with, but happens to be in the very same office, increasing the burden on the patient, the family, the other provider, and the healthcare system. We all have a common purpose of providing safe eye care to the citizens of New Hampshire, and for the right reasons with outcomes and access in mind. Safe, quality eye care, including in-office procedures, is not exclusive to ophthalmology.
My name is Dr. Jessica Eade. I'm an optometrist that practices in New London, New Hampshire. I just wanted the chance to tell you a bit about my background and how I practiced before coming to New Hampshire. I grew up in Texas and I cannot tell you how many times I have seen a patient who has needed one of these minor procedures in order to preserve their vision, and I've had to tell them, I have done this procedure countless times. I could do it for you right here today. However, the state of New Hampshire will not allow it. This is becoming more and more of a problem as ophthalmologists in our region are so busy that many will not accept new patients, and so we're having to refer them even farther away.
Physician will tell you we do not have the same education as them, and we agree. However, we do not want to be ophthalmologists. We want to be optometrists to the full extent of our education and training, which includes the procedures outlined in Senate Bill 440.
The problem is getting worse. A solution is so obvious. Allow us to practice the way that we are trained.